Hi, this is Dr. Sham, and today we are going to discuss about the medical error. So first of all, some basic points and the important points that it's all about the communication. Okay, you may or may not be one who has made the error, and the other thing is that you need not to blame anyone. Do not give the excuses like, say, for example, it was you missed a fracture, okay, and now you are saying that you are a junior doctor and you cannot read the X-ray, okay. Don't do this. Don't put the blame on anyone, okay. Just apologize and try to rectify. So we're going to discuss the structure, okay, by giving an example of missing a fracture, okay, so that you might understand it in a well way. So it can be a direct station or a telephone station. So let's start that this. So it's medical error. So the first thing is that you need to introduce yourself, okay. What you generally do, you introduce yourself, okay, and you identify the patient. That is the important thing, okay. And after that, this is important, you need to tell why you are talking to that patient, okay. So you introduced yourself, okay, you identified the patient, and then you can tell why, but do not give the reason, okay. Do not, okay, tell the details of the incident at this point. Just give a general statement. Say for example, um, I brought a child, okay, and I missed, okay, say for example, I missed a fracture. So I would be like, okay, after introducing myself and identifying the patient, okay, so I'm like, I'm here to discuss about your condition. Just a general statement. I'm here to discuss about your child's condition. Is that okay with you? Yeah, fine enough. Now, this is important, okay? So you need to introduce, you need to identify the patient, and then why, but a general statement about that. Okay, do not give that at the very beginning that I'm going to talk about an incident. No, 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 no. Not at that point, but later on. Here, you need to give a general statement that I just want to discuss your condition. Now, the next thing is you need to assess the knowledge of the patient, okay. It could be something like that. Before we move, okay, would you tell me that how much you know about your condition, okay. Will you give me a little detail about your condition, okay, about your condition, or you came to the hospital last time, okay, so would you tell me a little bit detail of your visit, okay. Just assess the knowledge. And the next thing what you do is that after that, okay, you need to assess. This is important again, assess the harm. Say for example, you missed a fracture, you need to now assess the harm, okay. Once the patient has told you that, yeah, I came to the hospital and I had a swelling, okay, and did the x-ray and I was sent home, okay, now you need to assess the harm, okay. I would like to ask you a few questions, okay. Would that be okay regarding your condition? So is there any, say for example, there was a fracture, so is there any pain, is there any swelling, okay, what about the mobility, is there any discoloration? So I'm assessing the harm because now I have to deal the patient accordingly. Say for example, there are no pulses and it's a discoloration. This means that it's an emergency, okay. You need to treat the patient accordingly. Say for example, I'm calling somebody, okay, and I'm saying take this fracture scenario, okay, and I need to ask that if there's a discoloration, I have to call the patient immediately. Maybe I have to send an ambulance if he's not coming. If everything is okay, okay, then yeah, you can take some time, okay. But this is important, assessing the harm, because you have to act promptly if there is some problem. So assess the harm, okay. Now the next thing you're going to do is now tell the details of the incident, okay, and apologize, okay. How? That's actually, I'm here to talk about an incident, okay, an error, a medical error which happened in your treatment, okay, and take sufficient time explaining these things, okay. Definitely the patient will be angry, okay, so you need to be prepared for that. Apologize, okay, that we didn't do it deliberately. It is important being a doctor that we should be open in the things, okay. And if a medical error happens, we need to explain everybody, okay, and we'll try to fix that one. I apologize for that, okay. Didn't do it deliberately, but this happened. I'm so sorry for that. Take some time over here at the point number 4 where you are telling the details of the incident and you're apologizing. You have to apologize for more than one. Okay. Now, what you're gonna do next? Now, if there is some error, so obviously you have to rectify that. You have to rectify that. Okay. Now tell patient what you're gonna do, how you're gonna rectify. You will do the further examination. You will do further investigation, and we'll do a surgery, or we will apply the POP or whatever. Okay, I'm taking an example of fracture. That's why I'm explaining in that way. And here, another important point is that, say for example, you have made the mistake. Now you have lost the trust. Okay, you have lost the trust. Now you need to involve a senior. Okay, you're gonna say that my senior will be here and he will assess you. Say for example, you have made a mistake. Okay, in that case, you have to say something like that because you have made a mistake. The patient is not trusting you anymore. So you need not to say something. Rather, you should say, okay, what we're gonna do is, okay, make him feel special now. Okay, because you have done some mistake. That my senior will be coming. Okay, he will be examining you, and we'll be sending more investigations, and um, then we're gonna treat it accordingly. If you know the already plan, it's given over there. Tell the plan to the patient as well. And the last thing you're gonna do is that's the paperwork. Now, a lot of people they say that okay, you can ask the patient, okay, that he can go to the um, complaint office or something like that, or patient advisory liaison department to make a complaint. Never do such a thing until unless the patient asks you for that. Rather, you need to say the patient, okay, and patient can ask you that how you're going to prevent such a kind of thing from happening again. So you need to tell a patient that I am going to fill an incident form, okay, rather than by yourself you are like sending the patient to the patient advisory and liaison department. No, no, no. Say to the patient that you are going to fill a paper incident form, or you have already filled an incident form, and what's going to do that will let my seniors as well as my um, supervisor as well as the hospital administration come to know about this incident, and we are very curious about our patients, and we're gonna make sure that such a thing never happens again to any of the patients. Okay, and fill the form. Okay, this is you're gonna do. Okay, that you're gonna tell yourself to the patient that I'm going to do, or either you have filled the this incident form, and what the incident form is going to do, that's gonna let the seniors, okay, as well as the hospital administration know about what has happened actually, and so that we can take each and every step that's possible to avoid such a kind of thing, okay, in the future. So that is about the medical error. Hopefully it's going to help.